Levoquiricins is used to treat an underactive thyroid gland hypothyroidism. It replaces or provides more thyroid hormone, which is normally produced by the thyroid gland. Low thyroid hormone levels can occur naturally or when the thyroid gland is injured by radiation medications or removed by surgery. Having enough thyroid hormone is important for normal mental and physical activity. In children, having enough thyroid hormone is important for normal mental and physical development. This medication is also used to treat other types of thyroid disorders such as thyroid cancer. This medication should not be used to treat infertility unless it is caused by how to use levoquiricin solution. Read the patient information leaflet and instructions for use if available from your pharmacist before you start taking levoquiricins and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily on an empty stomach, 30 minutes to 1 hour before breakfast. If you are using the medication that comes in a bottle, carefully measure the dose using a special measuring device spoon. Do not use a household spoon because you may not get the correct dose. Take the medication directly from the measuring device. Do not mix with any other liquid. If you are using the medication that comes in an ampule, the medication may be taken by first mixing it in water, or it may be taken directly without water. To take it by mixing in water, open the ampule as directed. Then turn the ampule upside down and slowly squeeze the soft middle part of the ampule to empty the contents into a glass or cup of water. Release pressure and wait a few seconds. Repeat squeezing and releasing the ampule at least 5 times until no more liquid comes out of the ampule. Stir the solution and drink all of the liquid right away. Rinse the glass or cup with more water and drink to make sure you have to. The dosage is based on your age, weight, medical condition, lab test results, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Do not stop taking this medication without consulting your doctor. Thyroid replacement treatment is usually taken for life. There are different brands of levoquiricins available. Do not change brands without first consulting your doctor or pharmacist. Certain medications such as cholestyramine, colestipol, colsavelop, antacids, sucralfate, simachepins, iron, sodium polystyrene sulfonate, calcium supplements, orlistat, lanthanum, sevelamer, among others. It can decrease the amount of thyroid hormone that is absorbed by your body. If you are taking any of these drugs, separate them from this medication by at least 4 hours. Symptoms of low thyroid hormone levels include tiredness, muscle aches, constipation, dry skin, weight gain, slow heartbeat, or sensitivity to cold. Tell your doctor if your condition does not get better or if it gets worse after several weeks of taking this medication. Common side effects. If experienced, these tend to have a severe expression. Sorry, we have no data available. Please contact your doctor or pharmacist. If experienced, these tend to have a less severe expression. Infertility in women. Infrequent side effects. If experienced, these tend to have a severe expression. Decreased calcification or density of bone. If experienced, these tend to have a less severe expression. High blood pressure, weight loss, rare side effects. If experienced, these tend to have a severe expression. Mood changes, pseudomutar cherubry, a condition with high fluid pressure in the brain, a heart attack, angina, a type of chest pain, complete stoppage of the heart, abnormal heart rhythm, heart failure, hives, seizures, a skin rash, trouble breathing, abnormal liver function tests, a type of allergic reaction called angioedema, fast heartbeat. If experienced, these tend to have a less severe expression. Irregular periods, a problem with menstrual periods, hair loss, muscle spasm, muscle weakness, difficulty sleeping, fever, low energy, excessive sweating, muscle tremors, temporary redness of face and neck, increased hunger, headache, heart throbbing or pounding, vomiting, diarrhea, stomach cramps, nervousness, irritability, anxious feelings, heat intolerance, increased pulse rate, full Before taking levothyroxine, tell your doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of increased thyroid hormones, aterocytosis, decreased adrenal gland function, heart disease such as coronary artery disease, irregular heartbeat, high blood pressure, diabetes. If you have diabetes, this drug may affect your blood sugar. Check your blood sugar regularly as directed and share the results with your doctor. Tell your doctor right away if you have symptoms such as increased thirst, urination, shakiness, unusual sweating, dizziness, or hunger. Your doctor may need to adjust your diabetes medication, exercise program, or diet. Before having surgery, tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to certain side effects of this drug, especially headache, vision changes, and hip-like pain. High thyroid hormone levels may lead to decreased bone development, growth, and reduced full adult height. Keep all lab medical appointments so the doctor can monitor treatment. Older adults may be more sensitive to the side effects of this drug, especially fast pounding irregular heartbeat. This drug may be used during pregnancy. Tell your doctor if you are pregnant because your doctor may need to change your dose. Levothyroxine passes into breast milk but is unlikely to harm a nursing infant. Consult your doctor before breastfeeding. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call Poison Control Center right away. Us residents can call their local Poison Control Center at 1-800-222-1222. Canada residents can call Provincial Poison Control Center. Symptoms of overdose may include a fast pounding irregular heartbeat, loss of consciousness, confusion, seizures. Notes: do not share this medication with others. Lab and/or medical tests such as thyroid function should be done while you are taking this medication. Keep all medical and lab appointments. Consult your doctor for more details. Miss dose. If you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up unless your doctor tells you to do so. Call your doctor if you miss 2 or more doses in a row. Ask your doctor ahead of time what to do about a missed dose and follow your doctor's specific directions. Storage. Store at room temperature away from light and moisture. Do not store in the bathroom. Keep all medications away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposal company. Prescription drugs heal us when we're sick, ease our pain when we ache, and prevent or control long-term conditions. But sometimes, even when they do the job they're supposed to, have unwelcome side effects. Don't let that make you automatically rule out a medication, especially if it's an important part of managing a health condition. But you shouldn't accept unpleasant reactions without question either. Know what to expect. Side effects can happen with almost any medicine, says Jim Owen, Doctor of Pharmacy and Vice President of Practice and Science Affairs at the American Pharmacists Association. They're common with everything from birth control pills to cancer-fighting chemotherapy drugs. Many prescription drugs, for example, cause stomach problems like nausea, diarrhea, or constipation because they pass through your digestive system. Others are like antidepressants, muscle relaxants, or blood pressure or diabetes meds that may cause dizziness. Some might make you feel drowsy, depressed, or irritable. Some may cause weight gain. Some may disrupt your sleep or your ability or desire for sex. I tell my patients that chronic symptoms are not acceptable, says Lisa Liu, MD, a family doctor at Goddard Memorial Hospital in Melrose Park. I won't allow them to have ongoing pain or discomfort unless we have tried every alternative. Ask for help. When your doctor prescribes a new medicine, ask about common side effects. You, your doctor, and your pharmacist should be working together so everyone has the same information. One says, you should know which side effects are serious, which ones will go away on their own, and which ones can be prevented. From the homely aspirin to the most sophisticated prescription medicine on the market, all drugs come with side effects. Many are minor, some are just an inconvenience, a few are serious, and some are just plain strange. Perhaps the most common set of side effects for drugs that work inside your body involves the gastrointestinal system. Nearly any drug can cause nausea or an upset stomach. It may only happen to a handful of people. For drugs used on the outside, skin irritation is a common complaint. To find more about a drug's side effects, look on the label of over-the-counter auto products or on package inserts or printed materials that you get with prescription drugs. Because the inserts often include a long list of possibilities, you may want to also talk to your pharmacist or doctor about what to expect and watch out for. Types of side effects. An allergic reaction could happen with any drug that can range from itching and rash all the way to a life-threatening anaphylactic reaction. Some drugs can't help but trigger side effects because of their chemical structure. The common allergy drug diphenhydramine, also known by the brand name Benadryl, is one. Though it eases allergy symptoms, it also blocks the chemical acetylcholine, and that leads to drowsiness and a host of other side effects, including dry mouth. Some drugs have very noticeable side effects at the right dose. Typically, orphanocomod and gentavine, used to prevent blood clots, usually works well and isn't bothersome, but serious internal bleeding can happen in the wrong situation. Side effects may show up only when a drug is mixed with certain other things. This might be called a drug interaction. For example, drinking alcohol while you're taking narcotic painkillers can cause an accidental overdose. This has led to many deaths. Another example is grapefruit juice, which can affect the blood levels of several drugs, including some blood pressure and cholesterol medicines. The DOF's role before a drug can come on the market. The FDA must approve it. The new drug applications that ANDAs submitted by pharmaceutical companies have, first and foremost, evidence that the drug has the effect it's supposed to have and is safe. This proof comes from testing the drug, first in animals and then in humans. Once the basic questions of safety and efficacy are settled, the FDA will approve the drug if it deems that its benefits outweigh its risks. Still, sometimes testing doesn't reveal everything about a drug's side effects, and they don't show up until after the medication enters the marketplace and more people start using it. That's where MedWatch comes in. The DOF's post-marketing surveillance program seeks voluntary input, mainly from healthcare professionals, on unwanted effects they see in the real world. Sometimes these reports are numerous or serious enough for the FDA to take regulatory action, such as adding warnings to a drug's label. This happened with the psoriasis drug Raptiva. The FDA required that the drug carry the agency's strongest warning, known as a black box warning, after it received reports of brain infections and meningitis in patients taking the drug. The drug was later taken off the market. The FDA also wants input from consumers when it comes to side effects. All prescription drugs and many products must be labeled with a toll-free number the agency has for letting it know about side effects with drugs called adverse events. You can report possible new but severe side effects through MedWatch at 1-800-FDA-10-8 or through the FDA website. Sometimes, the post-marketing information coming into the FDA is so disturbing that a drug is discontinued. Bakel, which lowers cholesterol, was strongly linked to a breakdown of muscle tissue that could be deadly. The drug was approved in 1997, and the manufacturer stopped selling it for years later. The anti-inflammatory drug Duract spent just 1 year on the market. It was approved only as a short-term use product, and the FDA found serious liver problems when people took the drug for longer than recommended. Drug companies are also required to report adverse events to the FDA. Failure to do so can lead to prosecution. In 1985, employees of two drug companies were fined or sentenced to community service for not reporting adverse events involving the blood pressure drug Selocrine and arthritis drug Oriflex. Both products were pulled from the market. What to know about azatriphyzinic uses, how to take, side effects, warnings, interactions, pregnancy and breastfeeding, cost compared with other antibiotics. Summary: azatriphyzinic azithromycin is an antibiotic that can help treat certain bacterial infections. It is generally safe to use while breastfeeding, but people with existing heart conditions should avoid this drug. Azatriphyzinic is an antibiotic in the macrolides class. The Food and Drug Administration (FDA) first approved azatriphyzinic in 1991. Like all antibiotics, azatriphyzinic can only fight certain bacteria. For this reason, it is important to talk to a doctor before taking the drug. It is not effective against viral infections or as a pain reliever. This article provides an overview of azatrafizinic, including its uses, side effects, warnings, and drug interactions. Azatrafizinic can fight a wide range of bacteria, including many in the Streptococcus family. It can stop harmful bacteria from growing. Healthcare providers tend to use this drug to treat mild to moderate infections of the lungs, sinuses, skin, and other body parts. A doctor may prescribe azatrafizinic to treat the following bacterial infections: sinus infections related to Moracencal catarrhales or Streptococcus pneumoniae, community-acquired pneumonia related to Chlamydia pneumoniae, Haemophilus influenzae, or S. pneumonia, chronic obstructive pulmonary disease, ococta complications related to M. catarrhales or S. pneumonia, some skin infections related to Staphylococcus or S. streptococcus pyogenes, or Streptococcus agalacticae, tonsillitis related to S. pyogenes, urethritis and cervicitis related to Chlamydia trichomonas, chancroid genital ulcers in males are related to Haemophilus ducreyi, certain ear infections in children aged 6 months and over, such as those related to M. catarrhales. How to take it. Azatrafizinic is a prescription medication. Therefore, people should not take it without a prescription. The drug is available in the form of a tablet, an oral suspension solution, an eye drop, and an injection. The best type and dosage depends on the infection a person has. People can take the drug with or without food. They should thoroughly shake the liquid form before use. Some examples of common dosages include infection dosage, community-acquired pneumonia, tonsillitis, skin infections. An initial dose of 500 mg MB followed by 250 MB once daily until day 5. Mild to moderate bacterial cough exacerbations 500 MB per day for 3 days. Or an initial dose of 500 MB followed by 250 MB once daily until day 5. Sinus infections 500 MB per day for 3 days. Chancroid genital ulcers a single dose of 1 gram of G. Urethritis. Cervicitis a single dose of 1 G. Gonococcal urethritis. Cervicitis a single dose of 2 G. Using antibiotics incorrectly can lead trusted source to the development of drug-resistant strains of bacteria, meaning that antibiotics no longer work against them. This is called antibiotic resistance. When taking azatrafizinic or any other antibiotic, people should heed the following precautions. Take the entire course of antibiotics the doctor recommends, even when starting to feel better. Do not take antibiotics without a prescription. Not all antibiotics can treat all bacteria. Do not share antibiotics. Do not take antibiotics on a different dosing schedule than the one a doctor prescribes. Immediately call a doctor if side effects develop. Go to the emergency room for symptoms of an allergic reaction, such as trouble breathing. Like all drugs, azatrafizinic can have certain side effects. These are usually minor. In clinical trials, only 0.7% of people stopped taking Zithromox because of its side effects. Most of the side effects that led people to stop taking the drug were gastrointestinal, such as nausea, vomiting, diarrhea, pain in the abdomen. Less common side effects, occurring in up to 1 of cases, include heart palpitations or chest pain, acid reflux, dizziness, headache, fatigue, vaginitis, a rash, dry skin, sun sensitivity. Serious side effects are rare but can include liver damage, especially in people with a history of liver health problems, heart rhythm changes, which are more likely in people who take heart rhythm medications, older people, and those with low blood potassium. Serious allergic reactions. People who have myasthenia gravis, a condition that causes muscle weakness, may develop worsening symptoms or breathing problems. People with a history of allergic reactions to macrolides or ketylides should not take azatrafizinic. Doctors should not prescribe this drug to treat pneumonia if a person has cystic fibrosis, has a hospital-acquired infection, has bacteremia, requires a stay in the hospital, is older or debilitated, has a significant underlying health problem, such as immune system problems. People should not rely on azatrafizinic to treat syphilis. A person should speak to a doctor about any existing heart, kidney, and liver conditions before taking azatrafizinic, including an irregular heartbeat and especially ketoprolegenic. What does the research say? A large 2012 cohort study found a small increase in the risk of cardiovascular death among people taking azatrafizinic. The risk was higher among those with other risk factors for heart disease, such as smoking, low physical activity levels, and a high body mass index of BMI. The study reported that when compared with amoxicillin, there were 47 additional cardiovascular deaths per 1 million azatrafizinic prescriptions. Among people with the highest risk of heart disease, there were 245 more deaths per 1 million courses of azatrafizinic. This suggests that other antibiotics, such as amoxicillin, may be a safer option for people with heart disease or certain types of heart arrhythmias. In 2018 source, the FDA issued a warning about the long-term use of azatrafizinic in people with certain blood or lymph node cancers who have stem cell transplants. Emerging research has suggested that azatrafizinic may increase the risk of cancer relapse in these people. Following a stem cell transplant, some people take azatrafizinic to reduce the risk of an inflammatory lung condition called bronchiolitis obliterans syndrome. The FDA have not approved azatrafizinic for this use. However, rarely, azatrafizinic can cause liver toxicity. People should stop taking the drug and call their doctor if they develop any symptoms of liver problems, including dark urine, itching, or yellow eyes. In newborns younger than 42 days old, azatrafizinic may cause a dangerous condition called infantile hypertrophic pulmonary stenosis. Caregivers should contact a doctor if a baby becomes irritable or vomits when eating. Drug interactions. Azatrafizinic may interact with other medications a person is taking. For example, using azatrafizinic while taking nalfenaviran, which is a drug that helps treat HIV, can increase the risk of liver abnormalities and hearing problems. Azatrafizinic can also increase the effects of blood thinners such as warfarin. Other drugs that may interact with azatrafizinic include digoxin, a heart medication, colchicine, a gout medication, phenytoin, a seizure medication, antacids that contain magnesium or aluminum. A person should tell a doctor about all current medications, supplements, and remedies before taking azatrafizinic. Always speak to a doctor before stopping taking medications. Azatrafizinic may be safe to use during pregnancy and while breastfeeding. Studies of animals who received very large doses of azatrafizinic did not find an increased risk of miscarriage or birth defects. However, there have been no high-quality studies in pregnant humans, so the drug label currently states that azatrafizinic should be used during pregnancy only if clearly needed. Azatrafizinic can transfer into breast milk and may remain present for 48 hours following a person's last dose. Although it is generally safe to use when breastfeeding, azatrafizinic may cause diarrhea, vomiting, or a rash in some babies. A person should tell a doctor if they are pregnant, might be pregnant, or are breastfeeding before taking azatrafizinic. If a nursing infant develops side effects while the parent is taking azatrafizinic, call a doctor for advice. Cost. The brand name version of azatrafizinic, azithromycin, is typically more expensive than the generic version. However, the price may vary depending on the pharmacy, a person's insurance coverage, and deductibles, and their geographic location. Azatrafizinic vs. Other antibiotics. Azatrafizinic treats many of the same infections that drugs such as penicillin and amoxicillin can treat. A doctor may prescribe azatrafizinic as an alternative to other antibiotics because it typically requires a shorter course. It is also a good option for people with a history of allergies to other medications, or when other antibiotics do not work. Because the risk of heart health problems is higher with azatrafizinic than with some other antibiotics, people with heart disease or arrhythmias should ask their doctor about trying a different antibiotic.